Hello and welcome to Pregnancy Info. Today we will discuss that how can we increase the low sperm count. But for that you have to diagnose that if you have low sperm count. When you see a doctor because you are having a trouble getting your partner pregnant, he or she will try to determine the underlying cause. Even if your doctor thinks low sperm count is the problem, it is recommended that your partner be evaluated to rule out potential contributing factors and determine if assisted reproductive techniques may be required. First of all, doctor will do a physical examination and take the medical history. This includes examination of your genital parts and asking questions about your inherited conditions, chronic health problems, illness, injuries, or surgeries that could affect fertility. Your doctor might also ask about your sexual habits and your sexual development. Semen analysis. A low sperm count is diagnosed as a part of a semen analysis test. Sperm count is generally determined by examining semen under a microscope to see how many sperm appear within a square or a grid pattern. In some cases, a computer might be used to measure sperm counts. Semen samples can be obtained in a couple of different ways. Other than semen analysis, other tests can also be taken. Depending on initial findings, your doctor might recommend additional tests to look for the cause of your low sperm count and other possible causes of male infertility. These tests include scrotal ultrasound. This test uses high-frequency sound waves to look at the testicles and supporting structures. Hormone testing. Your doctor might recommend a blood test to determine the level of hormones produced by the pituitary gland and testicles, which play a key role in sexual development and sperm production. Post-ejaculation urine analysis. Sperm in your urine can indicate your sperm are traveling backward into the bladder instead of your penis during ejaculation. Genetic tests. When sperm concentration is extremely low, genetic causes could be involved. A blood test can reveal whether there are subtle changes in the Y chromosome, sign of a genetic abnormality. Genetic testing might also be ordered to diagnose various congenital or inherited syndromes. Testicular biopsy. This test involves removing samples from the testicle with a needle. The result of the testicular biopsy can tell if sperm production is normal. If it is, your problem is likely caused by blockage or another problem with sperm transport. However, this test is typically only used in certain situations and is not commonly used to diagnose the cause of infertility. Anti-sperm antibody tests. These tests, which are used to check for immune cells or antibodies that attack sperm and affect their ability to function, are not common. Specialized sperm function tests. A number of tests can be used to check how well your sperm survive after ejaculation, how well they can penetrate an egg, whether there is any problem attaching to the egg. These tests are rarely performed and often do not significantly change treatment recommendation. Transrectal ultrasound. A small lubricated band is inserted into your rectum to check your prostate and check for blockage of the tubes that carry semen. Now, we will discuss the treatment in this video too. Treatments for low sperm count include number 1, surgery. For example, a varicocele can often be surgically corrected or an obstructed vas deferens can be repaired. Prior vasectomies can be reserved. In cases where no sperms are present in the ejaculate, sperm can often be retrieved directly from the testicle or epididymis using sperm retrieval techniques. Treating infections. Antibodies can cure an infection of the reproductive tract, but this doesn't always restore fertility. Treatment for sexual intercourse problems. Medication or counseling can help improve fertility in conditions such as erectile dysfunction or premature ejaculation. Hormone treatments and medications. Your doctor might recommend hormone replacement or medications in cases where infertility is caused or high or low levels of certain hormones or problems with the way the body uses hormones. Assisted reproductive technology or ART. ART treatment involves obtaining sperm through normal ejaculation, surgical extraction, or from donor individuals depending on your specific situation and wishes. The sperms are then inserted into the female genital part or used for IVF or intracycloplasmic sperm injection. But if any treatment is not working, in the rare condition, male fertility problem cannot be treated and it's impossible for a man to be father of a child. If there is the case, you and your partner can consider either using sperm from a donor or adopting a child. But you can also use some home remedies. They are steps you can take at home to increase your chances of getting your partner pregnant, including number 1, increasing the frequency of sex. Having sexual intercourse every day or every other day, beginning at least 4 days before ovulation, increases your chances of getting your partner pregnant. Having sex with fertilization is possible. A woman is likely to become pregnant during ovulation, which occurs in the middle of the menstrual cycle between periods. This will ensure that sperm which can live several days are present when conception is possible. Avoiding lubricants. Some products such as Astroglide or KY jelly lotions and saliva might impair sperm movement and function. Ask your doctor about sperm safe lubricants. Alternative medicines. Supplements with studies shown potential benefits on improving sperm count or quality include black seed, coenzyme Q10, folic acid, horse chestnut, L-carnitine, panic, ginseng, zinc. Talk with your doctor before taking dietary supplement to review the risk and benefit of this therapy, as some supplements taken in high doses or for extended period of time might be harmful. In this situation, what you have to do? Number 1, be aware of any pre-appointmental restriction. By the time you make the appointment, ask if there is anything you need to do in advance, such as refraining from ejaculation for a certain period of time or stopping certain medications. Number 2, write down any symptoms you're experiencing, including any that might seem unrelated to the reason for which you scheduled the appointment. Write down key personal information, including any major stresses or recent life changes. Find out whether you have a family history of fertility problem. Having a male blood relative such as your brother or father with fertility problem or other reproductive issues might give clues to the cause of low sperm count. Find out from your parents if you had undescended testes or other issues at birth or in early childhood. Make a list of all medications, vitamins, and supplements that you are taking in this period. Take your partner along. Even if you have a low sperm count, your partner also might need tests to see whether she has any problem that could be preventing pregnancy. It's also good to have your partners along to keep track of any instruction your doctor gave you or to ask questions you may not think of. Write down questions to ask your doctor. Any question in your mind about your problem or your situation is good to be asked by your doctor. So this is how you can increase the low sperm count. All the treatments and remedies are described in this video in detail. So if you find this video useful, then like it, share it, and also subscribe our channel. Thank you.